My name is Nirav Shah. I'm the director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to join everyone today to provide an update on COVID-19 across the state of Maine for today, Tuesday, July 21st, 2020. I'd like to provide an update on the epidemiological front and then turn it over to Commissioner Lambrew for updates on where things stand with respect to testing and other supports for hospitals in Maine. We begin today's update on a somber note. Maine CDC is reporting an additional individual who has passed away with COVID-19 in Maine. He was a man in his 70s from Cumberland County, and his passing marks the 118th death with COVID-19 across the state. During this difficult time of grief, we, all of us at the state, offer this individual's family, friends, and community our deepest condolences as they grieve his loss. Overall, Maine CDC is reporting 3,723 cases of COVID-19 across the state, an increase of 12 cases. Of those cases, 3,300 are confirmed and 423 are probable cases. Overall, across the state, 3,191 individuals have recovered, an increase of 32 recoveries. And right now in the state, 12 people are currently hospitalized with COVID-19. 8 of those individuals are in intensive care units, and 4 of them are on ventilators. Among our cases include 861 healthcare workers. To date, Maine CDC has fielded now close to 11,000 requests for consultation from healthcare providers and healthcare facilities across the state. I'd like to provide a couple of updates on outbreaks that Maine CDC is currently working on. One is an outbreak at the Walmart in Presque Isle, where Maine CDC is aware of 3 individuals who are employees of the Walmart who have tested positive for COVID-19. We've been working and will continue to work with the management of that facility as they consider undertaking testing as well as providing public education to individuals in the area who may have been exposed, as well as plans to help keep other individuals who may be visiting that location safe from COVID-19. I'd also like to provide an update on the outbreak that we talked about last week at the American Roots manufacturing facility. Maine CDC continues its close and robust collaboration with the management and staff and all employees at American Roots. The management of American Roots is conducting another round of universal testing on all employees today. Results of that round of testing should be available later this week, most likely on Thursday, and we'll report any results from that as they become available. I'd like to take a moment now to discuss a change to our numbers that will be on our website starting tomorrow. For those of you who have been looking closely at our case counts on a day-to-day basis, you may have noticed a high number of probable cases that were reported by Maine CDC this past Sunday. Those were probable cases that arose from a single camp for young people here in Maine. As part of its standard protocol, that camp had been testing all campers and counselors using what's called an antigen test. Now, antigen testing is a bit newer. It involves looking for the protein spikes that are on the surface of the virus. This is a different type of testing than the testing that our laboratory here in Augusta performs. Antigen testing can get you results a little bit more quickly, but sometimes the results can be a little less accurate. As part of this camp's standard protocol, they tested all the campers with this antigen testing. I'm sorry, not all, some of the campers with this antigen testing last week. They found a high number of positives, which they promptly reported to Maine CDC. We classify all cases that are probable we classify all cases that are positive from antigen testing as probable. That's our standard practice, and we thus reported them on our website as probable cases. But we also recommend that any case that tests positive through this antigen test be followed up with a confirmatory test using the methodology that our laboratory here in Augusta uses. So when we saw this increase of cases that were probable from one camp on Sunday, it struck us as worthy of further investigation, because until that point, everyone at the camp had tested negative multiple times, including before they even arrived at the camp. So, as is our standard process, we recommended confirmatory PCR tests for all the campers to confirm, or in this case, to rule out the results from the antigen test that they had done. In this situation, that was done, and then samples were sent to our laboratory here in Augusta. And it turns out that all of those results that had turned out as positive from this antigen test at the camp were actually negative when they were run by our laboratory here in Augusta. Now, we're working with the US CDC as well as the US FDA to investigate whether there might be a problem with the device that this camp used. But in the meantime, what that means for our numbers is that because those antigen tests have been shown to be negative by our laboratory here in Augusta, we are reclassifying them from probable cases, which is what they currently are, to negative cases, which is what they really are. That change will appear on our website starting tomorrow. But in the interest of transparency, I wanted to brief everybody on that change today before we make that change. The next thing I'd like to touch on very briefly is the number of individuals from other states who have tested positive here in Maine. As of today, Maine CDC has followed up on 120 individual cases that, following investigation, were determined to be of residents from other states. Those include states like New Hampshire, New York, and Massachusetts. There have also been 57 cases of Maine people in other states that have been reported to us. These are individuals who reside elsewhere and have tested positive and had their results reported to Maine CDC. Another metric that we're reporting is that there have been 133 positive molecular tests, not cases, but tests, and 2,074 negative cases from residents of other states that have been reported to Maine CDC as of today. Keeping in the vein of testing, I'd like to provide an update on where things stand both in terms of positivity rates as well as our testing volume. Based on 3,023 molecular tests reported to Maine CDC yesterday, our one-day point positivity rate was 0.53%. That brings our 7-day weighted average for PCR tests to exactly 1.0%. When you think about it in terms of testing volume as well, this increase of testing that was reported yesterday, over 3,000 cases, brings the number of tests, the rate of testing in Maine, to now 177.6 tests per every 100,000 individuals in Maine. This marks a relative high point for our testing. As we've talked about, we have more to do with respect to testing and more work to be done. So to talk more about that, I'd like to now turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. Today, I am proud to announce 3 advancements in COVID-19 prevention and mitigation in Maine. First, we are working with 4 additional COVID-19 swab and send testing sites. Second, we are awarding $1 million to rural hospitals to increase their COVID-19 testing. And third, we're welcoming a second round of applications for municipalities under the Keep Maine Healthy plan to support local public health, education, and prevention efforts. Maine people are to be commended for keeping the state's COVID-19 infection rates among the lowest in the nation, but we must continue our robust response to the pandemic. The actions announced today will further expand access to testing for residents and visitors, position our rural hospitals to increase lab capacity at a critical time, and enhance the valuable work of Maine municipalities in promoting the health of their communities. Specifically, the department is finalizing agreements with the City of Westbrook, Reddington Fairview General Hospital in Skowhegan, Penobscot Valley Hospital in Lincoln, and York County Community Action Corporation, along with Nasson Health Center in Sanford. These sites, in addition to the 18 we already announced, will send samples to the Maine CDC's Health and Environmental Testing Laboratory, or HEDL, for testing. They will offer specimen collection free of charge to any individual who believes they may have COVID-19 or could have been exposed to the virus, with or without symptoms, as defined under the department's standing order. These sites operate under several models, including drive-up, drive-through, mobile, and office settings. They typically require an appointment, and some of the swab and send sites are already in operation while others are coming online. The swab and send sites will help people take advantage of the Mills administration's vast expansion of testing capacity announced last month. DHHS is also announcing today action on bolstering capacity at labs operated by Maine's rural hospitals. Specifically, we are awarding $1 million in federal funding to 25 hospitals to expand their capacity to test for COVID-19 and other infectious disease outbreaks. Finally, the department is announcing a second opportunity for Maine municipalities and tribal governments to apply for funding under the Keep Maine Healthy plan. Earlier this month, we awarded almost $9 million to nearly 100 cities and towns. Now, the department is offering an additional $4 million to incentivize municipalities and tribal governments to develop and implement their own COVID-19 prevention, education, and protection plans. Municipal plans supported by the coronavirus relief funds from Congress include activities to help keep Maine people and visitors safe. They include public education, physical distancing, public health support, personal protective equipment, signs, and other means of keeping people healthy. Round 2 of the Keep Maine Healthy Grant Program will cover expenses incurred from August 1st through October 31st, 2020, with applications due to the Maine CDC by Friday, July 31st, 2020. I want to thank the Maine CDC staff, the Maine Department of Health and Human Services staff, and people in the governor's office, including Hannah Pingree, and at Maine CDC, Mike Abbott, for their hard work in standing up the municipal program and these other swap and send sites, and the rural grant funding, which will go a long way to improving access to testing in Maine. So with that, I'll turn it back over to you, Dr. Shah, for questions.
Great, thank you, Commissioner. We will turn to our colleagues in the media. Today's first question goes to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have one question for you, one for the Commissioner. I'll start with you, Dr. Shah. Could you give us a little more insider information about the red, yellow, green metrics that you're going to be using for the schools throughout the state and how you'll arrive at those classifications?
Commissioner and I are both very involved in that work, so we're happy to provide a bit more insight. The basis of those is to help give school administrators and school leaders a sense for what might be going on from an epidemiological perspective in their community as they are thinking about the safety of having children come in for in-classroom versus hybrid versus at-home education. The metrics that we use are similar to the metrics that are, frankly, already on our website in different ways. We are looking at a smorgasbord of things, not just any single metric, but they include, for example, the number of new cases of COVID-19 in that county, the positivity rate, a metric we've talked about a lot here, of tests that are coming back in that county, as well as the number of individuals and the percentage of visits to doctors, urgent care, and ERs with people who are remarking about symptoms that could conceivably be COVID-19. That's just an example of some of the metrics that we're looking at, not all of them. But as you can see, the purpose of these is to create a holistic view to help administrators gauge what might be going on with COVID-19 in their community as they're making this difficult decision.
And in terms of the expansion of the swab and send sites, can you just take us a little bit inside that process and why these 4 locations were the right fit?
Commissioner? Yep.
So we put out about a month ago a map of locations across the state of Maine that we identified where the vast majority of Maine people, 90%, could get to within a half an hour. So we use that map to really encourage applicants in those areas because we wanted to make sure these sites, which I'll explain why they're different than other sites, are accessible throughout the state. So the difference between these swab and send and other testing sites, which we have many of in Maine, are first of all, they're collecting samples to go to the Maine State Lab. Second, we are funding them through the end of August through a federal grant so people can access them free of charge. Third, these samples are collected in Maine and stay in Maine. We've been hearing about shortages and slowdowns in the national labs given what's going out throughout the nation. The tests that are taken, they're collected at these swab and send sites and sent to our lab, stay in the state, and we're hopeful that that means a speedy turnaround for those results for people who are waiting for them. And lastly, they operate under a standing order, which means that if you either have symptoms or are close contact with somebody, or you have elevated risk without symptoms, or you're part of a program that Maine CDC and the department recommend for testing, you can get a test without seeing your own doctor. We do still recommend people see their own doctor, but this gives them another option.
Thank you.
Thanks a lot, Brian. I'm going to turn now to Ashley Blackford at WAGM.
Hi, Dr. Shah. In regards to the outbreak at Walmart here in Presque Isle, is there any threat to the public?
Here's what I would say, Ashley, is that right now we're in the early stages of the investigation. And we're trying to figure out where individuals may have contracted COVID-19, whether it was at the workplace itself, or whether they may have been congregating outside of the workplace and happened to contract it there. That's something of a fixture in all workplace investigations. Generally speaking, in workplace investigations, those who test positive are held back, so they're no longer at the work site themselves, as in the case of Walmart. So if folks, the general rule still applies, which is if you're going out, please make sure you're wearing a face covering. Please make sure you're keeping 6 feet at minimum of physical distance between folks. So right now, we don't think there's any added risk of going to Walmart right now in Presque Isle if you need to. But as our investigation unfolds, we may learn more. And so it's all the more reason to remind folks to take precautions anytime they may be going out, Walmart included. I'm going to turn now to Patrick Whittle at the AP.
Thank you very much, Dr. Shah. 2 things. The organizers of the Maine Marathon have decided to cancel this year. I'm curious if they consulted with the state about that in any way, and if you have any thoughts about if it's a prudent thing to do, being that the event was scheduled for a couple of months from now. And speaking of a couple of months from now, we are coming close to the part of the year when people typically get flu shots. I'm curious if the CDC is going to step up its efforts to get those to people this year, since we're already dealing with 1 outbreak and why have 2?
So I'll take those in reverse order, Patrick. The answer on the latter, on the flu shot piece, is absolutely yes. Flu shots will play an outsized role in importance as we go into the fall season. It's likely that COVID-19 will still be with us. To what degree and to what extent and at what magnitude remains to be seen. But given the possibility that COVID-19 can place a strain on the healthcare system, the more folks that we can get vaccinated for influenza means the fewer folks that are in the healthcare system, potentially leading to challenges with others who have COVID-19, for example, getting healthcare. So we are right now planning, not just from a vaccination standpoint, but from an overall public health approach to try to keep flu numbers down as much as possible. We're also simultaneously working on other work on vaccines more at the childhood level to make sure kids go into the fall with all of their vaccinations fully on board. There's going to be more to come on that piece over the next coming days. So please stay tuned on that. With respect to the marathon issue, I'll turn that over to the commissioner.
Yeah, so we generally try to ensure that people know where the federal guidance is on different topics, any Maine specific guidance. We try to focus our work on guidance on those areas or sectors where there's either a lack of a federal guidance or some direct connection with the state. So activities like sports that are not necessarily regulated by the state are something that we do point people to the right types of guidelines. There are US CDC guidelines on many different types of sport activity, but we really do respect the fact that organizers of most of these events do follow those national protocols.
Thanks, Patrick. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. I first just want to follow up with the numbers for out-of-state people testing positive, because I think, as I jotted this down quickly, you said 120 people, out-of-state residents, have tested positive in Maine. 57 Mainers have tested positive elsewhere. But then you said 133 positive molecular tests. Is that among out-of-state people, and how does that jive with 120 positive tests? Is that a different type of test?
Sure, no, it's the same type of test. But what we've seen with COVID-19 is that some individuals may be tested multiple times. That may be because their doctor wants to get a negative test before they are released from isolation, if, for example, they have other chronic illnesses. So some individuals can be tested more than one occasion. Okay. And that's not uncommon. So in the interest of transparency, I wanted to make sure I provided everybody both with the number of individuals who have tested positive, that's 120, as well as the number of tests, 133. It suggests that there have been about 13 or so individuals who may have gotten more than one test, roughly speaking. It could have been one person who got several tests. That's less likely. Most of the time, it's folks who might have gotten not just one, but two tests. That's all it is.
Okay, thank you. And related to that, one of our listeners asks if a visitor to Maine tests positive after returning to their home state, is the Maine CDC notified, and who is responsible for the contact tracing? Because in some places, they aren't doing much in terms of contact tracing. We've had reports of someone who there was no contact tracing at all when they tested positive. So are you responsible for that if we find out that someone returns back to their home state, or does their own home CDC do the contact tracing, or do we just not even find out about it at all?
It depends on whether that individual was part of a classified outbreak. If the individual was part of a classified outbreak, an outbreak that occurred either here in Maine or perhaps elsewhere, then the states do collaborate on investigating those outbreaks. If the outbreak occurred here in Maine, the Maine CDC would take the lead in undertaking the contact tracing as well as any other type of case investigation, irrespective of where the individual's residences are. If the individual happened to be testing positive a couple of weeks after they go back from their trip to Maine, it would be their state health department that would be responsible for generating the list of all close contacts that the individual came into contact with. In the same way that if a Maine person were to take a vacation in another state and then come back a few weeks later, Maine CDC would take the lead in asking them for their contacts and who they interacted with. Now,
oh, sorry.
No, go ahead, Amy.
Sorry about that. I thought you were, I just wanted to clarify, if they are within that 14-day window and they return home and test positive, are they put on your radar at all, just so that you can say people who are all in one place, you wouldn't know there was an outbreak if they returned from a particular event or restaurant to several different states. But if it was being reported back to where they had been, you could see that an outbreak had occurred, if you follow what I'm saying.
So we find out about outbreaks in many different ways. States collaborate very, very closely in situations like this. If states happen to detect in their own states a spike in the number of people who all happen to be in Maine, or if a number of states happen to be in, there's a nationwide reporting system where states report instances of that nature, high numbers of people who all happen to be at the same wedding, things of that nature. And that allows us to piece together when multi-state outbreaks might be occurring. And then usually the states join up and conduct the investigations jointly.
Thank you.
Mm-hmm. And then as a side note, even though the numbers there, the 120 cases of individuals are there, it's just important to keep in mind that this is out of a total now of 3,700 plus cases. I'm going to turn next to Kevin Miller at the Press Herald.
Great, thanks. A question, follow-up question on the Walmart outbreak, and then another question on the antigen tests. So on the Walmart case, can you tell us, because I'm sure this is a concern for everybody who's out shopping about what happens when there are outbreaks or cases at retail shops. Can you tell us a little bit more about the steps that Walmart took after there was a discovery of positive case? Did they close down for disinfection, and kind of what the CDC is involved with now?
Yep. So Kevin, I can certainly take the latter point. We've just opened the investigation this morning, so we're still starting the process of working with Walmart to determine what the steps that they took were once they were notified. I'll have more to report on that over the next day or two. But in terms of Maine CDC's goal, our goals here, given that this is a workplace outbreak, are a fewfold. The first is try to figure out where the transmission may have occurred. Did the individuals who have tested positive thus far contract COVID-19 at the work site, or was it elsewhere? Number two, try to figure out who needs to be tested. Would it need to be all employees? Would it only need to be a subset based on where these three individuals were? If they were only in a discrete, cordoned off part of the store, it may only need to be a smaller group. And then the third is to try to figure out what kind of infection prevention measures can be put into place to prevent other staff as well as shoppers from getting infected going forward. Again, we just opened this outbreak investigation not just 3 or 4 hours ago, so we're in the very, very early stages of it.
So it doesn't sound like you've just reached that point where you decided whether all employees need to be tested or how many other employees might be tested.
We have not yet. I think there are probably calls that have been going on or are going on with our epidemiology team and our case investigators with Walmart. I know that those have been scheduled for the day. And so we are really in the early stages of figuring out what the layout of the store is, where these three employees may have been working, who needs to be tested, things of that nature.
Okay. And then, so on the summer camp and the antigen tests, so just to make sure I understand, antigen tests are different than antibody tests, right? Or are they the same thing? Can you explain the difference? And then I'll have a follow-up question there.
Yeah, I'm glad you raised that. I was wondering whether to go into that, and I'm glad you raised it, Kevin. So antigen testing, which is what this camp was using, is pretty different from antibody testing. I'll leave aside the molecular biology differences. The way that they are different from an outbreak perspective is that antigen testing, which is what the camp was using, gives you a bit of a snapshot around current infections. Antibody testing tells you about past infections. They can both be done in different ways, but antigen testing, which many of you have probably had, if you've ever gotten, say, a rapid flu test, those are often done by this antigen variety. It's a common way of doing testing for viral diseases because it can be quick, and generally speaking, the test results can be accurate. But they are different and not to be confused with antibody testing, which tells you what's going on in the rearview mirror. Antigen testing tells you what's going on right in front of you.
Great. And about how many cases were we talking about here, since you said that'll be reflected in tomorrow's numbers?
About 19.
19 cases, and that was staff and campers as well.
It was campers only.
Campers only.
Hold
Okay.
on. Oh, sorry, Kevin. Based on what we've been told, it's campers only. If that information is not accurate, Kevin, I will let you know. We will let you know. But based on the information that I've got, it's campers only.
And I'm sorry if I missed it, but can you tell us what camp that was?
Kevin, we talked about this. Generally speaking, we reveal locations of this nature when there is something of public health concern. In this case, it's in effect the opposite. There's not a public health concern. So for that reason, we're actually not going to reveal the name of the camp.
Okay. All right.
Yep.
Well,
Yep.
Thank you.
You bet. Generally, we do, again, when we feel like there's something of public health importance, but here it's, in fact, the opposite. So I'm going to turn now to Patty White over at Maine Public.
Thanks, Dr. Shah. I had a question about the $1 million to rural hospitals to bolster capacity. How much of an expansion of testing do you anticipate? Is there a certain number of tests that you're expecting that will hospitals will be able to do now because of this?
Sure. So we are mostly trying to give them a little boost. Each of these hospitals would get about a $40,000 grant, each of them to use in their own way. Some of them have said that what they really need is to improve how they get samples to and from different labs. Others really think that they need to get a new piece of equipment. Still others think that they need to train some more staff to be able to collect specimens for COVID-19, but also generally. So we wanted to be flexible in the support for these hospitals and hope that they use it to, first and foremost, better connect to COVID testing, but secondarily to make sure that they have, again, the tools and the equipment and the staff that they need to be more self-sufficient, recognizing that testing is important.
So is it to, perhaps boost the number of tests they do, but even also the how quickly they're able to process them?
Yeah, to be clear, they're capacity grants. They're not actually testing grants. We're not giving them money to, conduct the tests. It really is to make sure that they have the tools, the staff, and the ability to get people in their areas, their patients tested, especially knowing that rural Maine has particular challenges in access. So we want to make sure that we are not just providing these swab and send sites for COVID-19 testing, but providing the hospitals in rural Maine with additional support so they can do their own testing themselves.
Great. And is it possible to get an update on the announcement last month about, boosting capacity overall in the state by 25,000 tests in the mobile lab? I know we've talked about it recently, and it's going to be a stepped process, and there have been some delays with the lab, but can you just tell us the status of that?
Sure. So we continue to work on a daily basis to expand our capacity. That includes everything from the physical equipment. We have the mobile lab, we're installing equipment, we're testing that equipment, to staff, because we need to expand our staff as we increase by multiple folds our testing capacity. We need the people to do that. This is not something that happens automatically, especially given that these are sensitive and important tests. We take our human testing at our state lab very seriously, so that training component is really important. So we feel like we are getting close to the point where we can really move staff into that mobile lab and begin testing. I don't want to put a specific date on it because we hope it's soon, but we are still working through things like equipment that we were supposed to have gotten 2 weeks ago suddenly arriving, and vice versa. Sometimes things get delayed. So we feel confident that in the coming weeks, we'll be able to really go to that extra capacity that will happen with the mobile lab, but it's a work in progress.
Great. And one more question, if I may. Can you say the device that the camp used for the antigen test?
Sure. The name of the device, the device is manufactured by a company called Quidel, spelled Q-U-I-D-E-L. Q-U-I-D as in Delta, E-L. And the name of their antigen platform is called the Sophia, S-O-F-I-A.
Thank you.
You bet. I'm going to turn to Jay Mishkin at WGME.
Thank you very much. And I'm actually just reading something that the Washington Post has printed with the CDC is changed some of its recommendations for isolation from 14 days to 10 days. And it looks like it's specifically for people who have tested positive. Will this new information change anything with the state's recommendations for quarantines over 14 days?
Yes, Jay, you're absolutely right. So yesterday afternoon, the US CDC briefed state health officials and released updated their guidance around when somebody can be released from isolation after having been tested positive for COVID-19. The biggest change, there are a number of changes, but among the largest change is brand new data that suggests that after a certain period of days, individuals are no longer spreading the virus in ways that can cause infection among other individuals. So in light of that, and in recognition of the importance of folks being deemed to be recovered so that they can rejoin their families, rejoin the workplace, things of that nature, the data now show that rather than the 14-day margin, which it had been previously, a different number of days is appropriate in order for folks to be deemed to be recovered. So that's one significant change. Maine CDC is in the process of operationalizing that with our contact tracing and case investigators so they can reflect that information as they're interacting and checking in on confirmed cases. The other change that the US CDC made was also one that suggests that with rare exception, this actually goes back to something that Amy Brown asked actually, US CDC, based on newer data, is really strongly recommending that when it comes time to determining whether someone meets the criteria for isolation, that state health departments utilize this symptom-based approach. As folks may recall, there are two ways that folks can be determined to be recovered. One is that your symptoms have resolved and have stayed resolved, or you can get multiple tests that come back negative. Previously, the US CDC somewhat thought that both approaches were acceptable, but more recent data have shown that the symptom-based approach, waiting X number of days after your symptoms have resolved, is a far better approach to letting folks come into that recovered category and thus being able to rejoin their families and their workplaces. They're recommending and reserving the symptom-based approach only for individuals in certain medical categories, like folks who might have immune system issues. So those were some significant changes. We're putting them into operation at the Maine CDC right as we speak.
But those changes won't affect the 14-day quarantine for out-of-staters. That 14 days, because it's not people who are showing symptoms, that remains at that level, correct?
You are correct, Jay. This is for individuals who have been confirmed, laboratory confirmed to have COVID-19. It does not affect, and the CDC did not change their recommendations for a quarantine period. That remains at 14 days. If someone, for example, is traveling here from another state, or if someone has been exposed to a person with confirmed COVID-19, that period of days remains the same.
I may, my original question now. So this morning on CBS, Surgeon General Adams said pretty explicitly that the biggest determinant for him in returning to school is the background transmission rate. Looked on your website today. I didn't see it on your CDC website. It might be there. I did find it on two other sites that claimed Maine's transmission rate is somewhere between 0.85 and 0.95. Do you believe that number is important and critical to reopening schools? And should local school districts be using it to determine if they can do in-person classes versus remote classes?
So Jay, that number is important. And as we were chatting about just a couple minutes ago, I think in connection with maybe Brian's question, the factors that we are using as we think about various color categorizations are all intended to better characterize the background rate of transmission of COVID-19 at the county level. Some of those get distilled by different websites into a certain number that can be useful for different purposes. We like to take a more holistic approach and not just look at one single number, but look at a variety of different metrics, such as the number of new cases, the positivity rate, the types of symptoms that folks are reporting. All of those things taken together provide a far more accurate picture of what's going on at the community level when it comes to COVID transmission. I concur with the Surgeon General. That is a very important factor as we think about moving children back into the classroom in the fall. I'm going to turn now to Brooke Riley at ABC 7.
Thank you, Dr. Shah. Two kind of questions, I guess I could say. Going back to the camp, do you know what made them start testing these people, like from the start?
Yes, it was their standard protocol per the camp and their medical director in order to keep children, their counselors, and the community safe. Children, as well as counselors and all staff at this camp, had to have a negative PCR test before they could come into Maine. And then the camp itself, per its normal protocol, tests campers and staff on a regular basis. So this was part of their normal protocol.
So this camp was people coming from all over then?
Yes, I don't know from which states, but it was from a number of different states.
Okay, and then you said that there were originally 19 that tested positive, and none of them ended up being positive.
That is correct.
Okay, thank you.
You bet. I'm going to turn to Bob Evans at News Center.
Good afternoon. I only have one question today because you answered quite a few of the other ones. Over the weekend, you reported that Maine had its youngest death so far from COVID-19. Is there any additional information people should take away from that news?
Yeah, Bob, you're right. That was a hard and a very saddening report. As many may recall, Maine CDC over the weekend reported the passing of a man in his 20s with COVID-19. And I think what I would note for everybody about this is that it's a reminder for all of us that COVID-19 can affect even younger folks. We have traditionally and thus far thought of COVID-19 fatalities as affecting older individuals. And statistically, that's the case. But this is unfortunately a sad reminder that COVID-19 can affect individuals of all ages across the entire spectrum. And so when we think about putting on a face covering before you go outside and maintaining physical distance when you're around others, there's a reason. And when individuals pass, especially when someone in their 20s passes, it's an unfortunately stark reminder that COVID-19 can affect just about anybody. I'm going to turn to Megan at WMTW.
Thank you, Dr. Shah. My question is going back to the summer camp that you mentioned. So in light of, what was first thought as a possible outbreak at a camp among children, presumably school-aged children, is there any takeaway from the response when that the camp had, that the Maine CDC had, as we consider and advise on how and when to send kids back to school? Also, is testing ever come into play as part of the advice and the guidance you may be giving school districts?
So as to the former, Megan, just not too long ago, about 55 minutes ago, I was huddling with my team about that exact question that you raised, which in a slightly different format, which was, did the system work the way it should have here? Were there any things that should have happened from a reporting or an investigation perspective that didn't happen that we need to fix immediately and course correct? Fortunately, our quick hot wash of the situation suggests that the reporting occurred the way it did. The camp quickly reported their positive results to us. We noted that there was something a bit atypical about the situation. We immediately started the investigation process. We noticed that the pieces weren't quite adding up. Everyone had tested positive previously. No one was reporting symptoms. We then spoke with the camp's medical director to get a finer sense of how the testing occurred and what the potential reasons for this might have been. We immediately ordered confirmatory testing that was done at our lab here in Augusta. So it suggests that the public health apparatus and system we have in place is working the way it should with respect to these atypical situations. I'm sure there will be things that we can and will learn about this situation. And as we learn more about what might have gone wrong perhaps with a device, we'll make sure we build those into our own protocols. But right now, one of the things my team and I were talking about was that this was noticed, it was investigated, and now it's being reported on in a timely fashion. As it relates to what this tells us about testing at schools, well, there have been discussions about the utility of more widespread testing. But what we've also learned from other countries that have had more and deeper experience with schools and reopening is that the best way to prevent COVID-19 from entering a school is sort of similar to what Surgeon General Adams said, which is to reduce the overall levels of COVID-19, the background rate in the community itself. That's the best way to prevent COVID-19 from ever entering the school. As opposed to testing, let's work on the front end to keep the background rates in the community as low as possible. That's the surest way to prevent it from entering the school doors. And the last question for the afternoon goes to Charlie from the BDN.
Yep. Hi, Dr. Shah. Thank you for taking my questions. The first one is pretty specific about the state lab in Augusta, which is just in terms of testing for COVID, how long is it generally taking nowadays to return test samples that have been sent there, and have there been any backlogs in recent weeks?
Great. I'm glad you raised that, Charlie. I want to make sure I'm precise and exact in my answer. There is, first of all, flat out, there is no backlog at the Maine CDC laboratory. Our turnaround from the time that tests come to our front door to the time that results are reported back to the submitting physician is approximately 24 to 48 hours. More recently, it's been right at about 36 hours. But to be sure, Charlie, that's the time it takes for a specimen to be delivered to our lab and the time it takes for that result to be given back to the providing physician. There can be additional time it takes for the specimen to be transported up here to Augusta. There can also be time between when the physician's office is notified of the result and when they are able to deliver it to the patient who is under the care of that physician. Both of those things can and have always been there ever since we've started testing, not just for COVID-19, but every other test that the Maine CDC laboratory does. But I just wanted to make sure I was clear. We're not ignoring those things. It can take a day to get samples here, and it can sometimes take doctors' offices a little bit of time to deliver results to patients. Those add to the possibility of time it takes. But what we have under our control is what happens in the time it takes between when a sample gets to our front door and when the doctor's office is given the results. Commissioner Lambrew?
Yeah, and I'll just add, we will also have under our control some of those operational elements for the swab and sends. Part of the goal of standing up these sites is that we can work with them to optimize it, to try to shrink down that front end to make sure from the time a person walks in to get the sample to the time that that sample comes back to that swab and send and gets to that person, we're doing so rapidly. So that is one of our projects as we begin to have these sites go live, is to work with those sites to make sure that we are doing our best to make sure that people who get tested at these sites get those results rapidly.
And I'll build on what Commissioner Lambrew just noted. One of the ways that we're doing that, Charlie, is implementing a new front-end and back-end IT architecture. It's a system that will allow the physician or the swab and send that's sending the patient to us to log that sample in our computer system before they send it over. Right now, much of that is done when it hits our front door. But if the swab and send or the doctor's office can log that information in our IT system before they send it to us, that reduces the amount of time that our team has to spend entering it once it's here, essentially making it available on the front end. That will also speed up the delivery results on the back end, because rather than doing it the traditional manner, we can just report the results electronically to the individual physician or healthcare provider that submits it. So we're trying to do everything we can, working with experts in process improvement and optimization to keep that time as short as possible. As Commissioner Lambrew noted a couple of moments ago, I'm sure everyone is aware of reports at the national level where national laboratories like Quest and LabCorp are seeing increasing number of days it's taking them to turn results around. That's one reason why these swab and sends, keeping the tests in Maine, are really important. Well, I'd like to thank everyone for their time today. Oh, yeah, go ahead, Charlie.
Oh, I just wanted to ask one more follow-up to that, which is in speaking to some providers today, hospitals, they've told me that a few things, basically that they haven't all thrown open the doors yet based on that standing order from last month, and they're still not bringing in everyone who falls under that order to do tests, and that has to do with having trouble getting swabs and transport media, and then some delays in the delivery of samples and that sort of thing. Do you just have any more an update on how far Maine is in kind of testing everyone who is in that standing order, and whether there could be an opening of it, a loosening of it at some point in, when could that happen?
So Charlie, I'll answer the first part. Then the latter part is, you mentioned loosening the standing order. It's already quite broad to begin with. But let me note your first question. We are aware, and we've had Commissioner Lambrew and I have had numerous conversations with healthcare providers who have expressed those same concerns to us, and we agree. Nationwide, there still are not a sufficient number of swabs out there to test everybody that I think any healthcare provider might want. We're working pretty aggressively on that, including with a manufacturer of those swabs here in Maine, to secure as many of those as we can for Maine people, particularly for the swab and send sites that we've been working on, to make sure that testing can happen. What I will say is that just in the past month, the availability of those supplies has increased. And this is borne out by our testing data. A month ago, we were testing approximately 100 to 110 people per 100,000 people in Maine. Today, that number stands at over 170 tests per 100,000. That's partly a function of the greater availability of testing supplies, swabs, and transport media. So progress is being made. We've still got more to do, but progress is most definitely in the works. Commissioner?
So with today's announcement, we have 22 sites across the state that will be accessible to the vast majority of people in Maine. We are working on swabs. We have the agreement with IDEX that provides us with reagents that we think are sufficient to really fulfill the standing order in terms of what it means. And we also are working with Maine manufacturers of PPE, recognizing that even that personal protective equipment may become scarce if indeed the epidemic continues at the rate it is in the South. All that said, we're confident that under the standing order, with these swab and send sites, with the capacity expansion at the state lab, we really can meet the needs of people in Maine.
Very good.
Thank you.
You bet, Charlie. Well, I'd like to thank everyone for taking some time out of their afternoon to join Commissioner Lambrew and me to talk about and hear about the latest with COVID-19 across the state. We look forward to joining everyone again on Thursday to provide more updates on everything that's going on. In the meantime, as always, I ask everyone to please be kind and take care of one another. Have a good afternoon, and we'll talk again on Thursday. Thank you very much, Dr. Thibodeau, for your help today, too. Have a good afternoon.